In staff writer at The Atlantic magazine, Ed Yong. He won the Pulitzer Prize for his coverage of the COVID-19 pandemic. He's also the author of the new book, An Immense World: How Animal Senses Reveal the Hidden Realms Around Us. And we're going to get to that in just a moment. But first, we want to get a sense of where we are with COVID. I feel like there's more coming. It's not behind us, but things are better. Ed.
Yeah, I agree. I think we've been through another surge. Cases and hospitalizations are up, but fortunately, ICU admissions and deaths have not surged in the same way. In a sense, that's good, but I think that leaves us a little bit complacent in the face of many of the challenges that we still face. Relying on things like vaccines to blunt the burden of severe disease and death does leave out the importance of preventing infection, which is still very much a big issue. Infection increases the risk of long COVID. It taxes our healthcare system, which even if ICUs aren't full up, is still already in a permanently stressed state. I've written before about how our hospitals are still overburdened because of people who have left the profession. The healthcare system really can't take much more. It's already on a tenuous footing, and any kind of shock to it stresses the resilience that it just doesn't have right now.
Ed, I'm glad you brought up long COVID. Certainly, it seems like America wants to be done with this pandemic, and there are some who say, well, yeah, if you get it, no big deal. You'll be down for a few days or a week at most, and then you'll be all right again. But there's still so much we don't know about long COVID and ramifications months, years down the line. You speak on that a little more if you'd like, but also the experts you speak to, I know regularly on the matters of the pandemic, how fearful are they there could be new variants emerging, particularly, say, this fall or winter, some of which perhaps could evade some of the protections offered by vaccinations?
So let's talk about long COVID first. This has been an issue throughout the entire pandemic. We know that even people who aren't hospitalized, who don't count as having, quote, severe illness, can nonetheless be severely disabled and incapacitated for months, if not years. And because of the neglect of this condition, we still know very little about the risk factors, how to prevent it, how to treat it. We're getting there, and we're getting there largely on the basis because of work of long haulers themselves who've advocated for their own lives, for their own protections. I think they've done a tremendous job, but there is still an uphill battle left to fight because of our negligence of preventing infections. You've also talked about, you also asked about what is to come, about variants on the horizon. And I think that is very much a major thing to be concerned about. Again, this speaks to the necessity of controlling the spread of the virus, of reducing infections, rather than just focusing on severe illness and death, as many in the government and other parts of the country are doing.
All right, so we want to talk about your new book out today, An Immense World: How Animal Senses Reveal the Hidden Realms Around Us. I have the cutest dog with me right now. I was going to ask you about him, but first about the book. What do we learn about animals, Ed?
So the book is about the sensory world of other animals, the fact that each species has its own set of sights and sounds and smells that it can tap into and that other species might not. So I, as a human, can't sense the electric fields around us, the magnetic fields of the planet that songbirds and turtles can use to navigate. I can't see ultraviolet light that would make flowers and birds look entirely different to my eyes. Each species has its own unique way of perceiving the world, and An Immense World is sort of a travelogue, a voyage through those sensory worlds.
And tell me, what made you become so interested in this concept? What triggered this?
I've long been interested in it. The idea for this book is actually my wife's idea. She also used to study the way coral reef fish see colors. But I think this is just an endlessly fascinating area. It opens our minds up to such cool biology, but I think it also recasts the world around us in a very different way. When I walk my dog, Typo, who is a corgi, I pay attention to the way he sniffs, and the way he explores the world with his nose tells me that the streets around my neighborhood that I'm so familiar with and that might seem boring to me are actually changing all the time. Through Typo's nose, I get to see the mundane in a new magical way. I get to find flickers of the extraordinary in the ordinary.
Ed, that is fascinating stuff you're writing about there. I mean, I don't know of anyone with a higher sense of danger than a chocolate lab. They just sniff out potential danger around the corner. But I'd like to talk briefly with you about something you mentioned a few moments ago, our healthcare system. Front page story in the New York Times today, COVID deaths at low rate even as infections climb. But let's talk about the underbelly of the health system and the dangers to the health system because of the number of nurses who are just retiring, leaving the positions, leaving doctors unable to schedule surgeries because there are not enough nurses. Things like that, all due to what COVID did to damage the nursing profession.
Absolutely. The nursing profession was already overstretched before the pandemic and has taken a huge hit during it. COVID's effects are cumulative. It's not just what is happening now in terms of hospitalization numbers. It's the total effect of 2+ years of trauma and horror. The nursing profession has been on the absolute front lines of that. They see what happens to patients. And between that, horrible working conditions, a lot of them have decided that they've had enough. What that means is that there are fewer people at the bedside to look after patients, but there's also less experience. A lot of veteran nurses have left, and that means that on the whole, the American healthcare system just knows less than it used to do. And that cannot help but lower the standard of care for all of us. That's the predicament that we currently find ourselves in, and that isn't going to go away anytime quickly. We are going to have to grapple with that for years to come. And regardless of what COVID does, even if COVID disappears tomorrow, which it isn't going to do, then the effects on the healthcare system are going to last for a long time.
So, Pulitzer Prize-winning reporter for The Atlantic, Ed Yong, I finally got the dog in the shot.
Oh, my God.
This is Hobson. How cute to see.
He
senses everything.
Hard to believe you were able to get that up past the guards in your 54th
I'm exhausted.
floor.
Okay.
30 Rock condo.
Thank you very much, Ed. The new book is An Immense World, How Animal Senses Reveal the Hidden Realms Around Us. And thank you, Hobson. Coming up, the latest...